What research does PCORI fund? Thinking about applying for PCORI-funded research? Let's break down what types of studies they support and which ones they don't. PCORI, the Patient-Centered Outcomes Research Institute, is a nonprofit research funding organization. PCORI primarily funds patient-centered comparative clinical effectiveness research, also known as CER. CER looks at different, well-established treatments, clinical interventions, or healthcare approaches to compare benefits and potential harms. The goal? To generate evidence that gives patients, caregivers, and the broader healthcare community information to make informed healthcare decisions that reflect their unique needs and preferences. PCORI has supported a wide range of patient-centered CER projects. Some examples include studies that have compared surgery versus medication for treating acute appendicitis, different anesthesia approaches for older adults having hip fracture surgery, and two commonly used inhalers for patients with severe asthma. Other PCORI-funded CER has compared different ways of delivering mental health care for people with complex psychiatric conditions, and different telehealth approaches for people who receive care at rural clinics. PCORI also funds research related to CER, like projects aimed at advancing the science of engagement in research and improving research methods for patient-centered CER. At the same time, it's helpful to understand what PCORI generally does not fund. PCORI does not typically support studies that focus on developing and validating instruments such as new surveys or scales, testing or validating new tools or decision aids, studies designed to test the efficacy of unproven interventions, or pilot studies intended to inform larger efforts. PCORI also does not fund cost effectiveness analyses, studies that compare the relative costs of care as the primary criterion for choosing between alternatives, or research comparing patient characteristics. Lastly, proposals that do not include patients or other members of the healthcare community throughout the research process will be considered non-responsive. To learn more about what PCORI funds and what it doesn't, visit pcori.org for detailed guidance and resources.